On October 30th, 2007, I entered the Atlanta VA hospital to undergo an outpatient surgical procedure. I was hooked up to an IV and given sedation to put me to sleep. I'm not sure how long I was in surgery, but I woke sometime later to my gynecologist smiling at me, saying, "The surgery went well. We did find endometriosis, but we ablated it off. You'll receive your outpatient post-operative care information, and I'll see you soon for a follow-up." For as long as I can remember, I have always suffered from an extreme painful menstrual cycle, and it wasn't until I was 29 years old that I found the cause of this pain. I had endometriosis and didn't know it. I had never even heard of this word before then, but I was about to get very acquainted with it. According to the Endometriosis Association website, www.endometriosisasn.org, endometriosis is a chronic disease that affects at least 6.3 million women and girls in the United States, 1 million in Canada, and millions more worldwide. According to the Endometriosis Foundation of America Facts and Statistics section on www.endofound.org, endometriosis is one of the top 3 causes of female infertility. I am among these millions of women, and living with this medical condition isn't always easy. I want to provide some insight on a person living with endometriosis and the effects this medical condition has. I want to explain what endometriosis is, the diagnosis and treatment of this condition, and finally how living with endometriosis affects the person with this condition and how it could affect her loved ones. Endometriosis is a female health disorder that occurs when tissue cells from the lining of the uterus grow in other areas of the body. And behind me, I'm going to pull this closer, is actually a demonstration of the endometriosis. Here you can see the female uterus, and the tissue lining, that cell tissue lining, is called the endometrium. That's the lining of the uterus, and it starts to grow outside into other areas. And here you can see is actually on an ovary on this demonstration. Okay. Many women have endometriosis and don't know they have this condition. It's not until they undergo surgery that they are diagnosed. Celebrity Tia Mowry has endometriosis and stated, "I was 27 years old when I was diagnosed with endometriosis. I knew nothing about it. Why hadn't I?" The symptoms women experience are painful menstrual cycles, excessive bleeding, pain with urination and or bowel movements, painful sexual intercourse, and even infertility. I, like so many other women, go and have gone years of living with these symptoms and not know why we are experiencing such excruciating pain. We all go back and forth to our doctors trying to figure the causes of the pain, but have not been able to pinpoint the exact reason. That's because there is no exact cause of endometriosis. It is believed that when women menstruate, the fluid flows backward into the fallopian tubes and into the pelvic cavity instead of flowing out of the body. In order to get to the root of these symptoms, you have to consult with your doctor, normally a gynecologist, and once you and your doctor discuss these symptoms of endometriosis, you now have to go about properly diagnosing and treating this condition. Based off your symptoms and the area of pain, your doctor will conduct exams such as a pelvic exam, where the area is checked for abnormalities. He or she may also do an ultrasound to get images of the area or areas for a better view. These examinations, however, will not give you the definitive diagnosis. In order to properly diagnose endometriosis, your doctor will schedule a surgical procedure that will consist of a laparoscope, being inserted into a small incision. This will determine the exact location and the severity of the endometriosis. The surgeon can also ablate or remove by chipping off what they see while they're looking around. After you have a true diagnosis of endometriosis, you and your doctor will then discuss and begin treatment based off the severity of the endometriosis and whether or not you desire to become pregnant. Treatment options consist of pain reliever medication, hormonal contraceptives such as birth control pills and or the Depo-Provera shot. You may also be treated with a gonadotropin releasing hormone agonist and antagonist. These are drugs that make the body think it's in menopause and can help to shrink the endometriosis for the length of the treatment and possibly months to years later. For women who wish to become pregnant, you may have to go through in vitro fertilization to help become pregnant. And for other women, unfortunately, becoming pregnant will not happen, and she may even have to have a hysterectomy. Now that you have a treatment plan in effect, you can now learn how to live with endometriosis. This will become the blueprint for your life as you go forward to help keep this condition under control, since there is no cure. There will be good days and there will be bad days, but informing your loved ones and getting them involved help living with endometriosis a lot easier. For men in the audience, I know you have been wondering, how does this condition have any effect on me? Well, you may have a wife, a mother, a daughter, a sister, or a woman who you have a very close relationship with who has endometriosis, and being educated on this condition can help you help her emotionally, spiritually, and possibly physically with this condition. By maintaining a proper diet and exercise routine, as well as following your treatment plan mapped out by your physician, you can live comfortable with endometriosis. Most of you can now enjoy activities that you could not do or had not done in a long time prior to the proper treatment. Learning all there is to know about endometriosis and how to treat it has changed my life, and now I enjoy living my life to the fullest. Thank you.